Now we're looking at some aspects of this thing, what they call it. This is clinical anatomy. So this is around the spine down. So here we're actually still at the cervical vertebrae. So the clinical anatomy is more of like you trying to look at, okay, the cervical vertebrae, what are the things that could actually affect the cervical vertebrae, you know. So here we are looking at what is known as cervical spondylosis. That's degenerative changes that could occur to the cervical vertebrae. You know. So for the cervical spondylosis, you could see this is a picture of it, and it just had to be with the intervertebral disc. They are actually degenerating. They are spoiling up, so to say. You know. So it just refers to age-related degenerative changes. I mostly see it in cervical spine, and it will often cause your neck to become so stiff and painful. Sometimes it could even affect the nerves there. You know, so it leads to radiculopathy or myelopathy, and it's extremely common after the age of 50 and can range from mild to severe. Do you understand? So what is it? It's changes that usually affect the cervical spine, usually comes with age. Above 50 is common, you know. So the intervertebral discs, the facet joints, the ligaments, and the vertebral bodies there, they are degenerating. When you say something is degenerating, it's kind of like the thing is wearing away. Okay. So causes is primarily due to age, but it can worsen when you are in a type of maybe do something that they always use your neck or something, you know. So epidemiology is usually seen in people that have hit the 5th decade of life. Now, neck pain is the second most common musculoskeletal complaint after low back pain. Like it will usually cause neck pain, right? And neck pain, lots of people complain about neck pain. Apart from back pain, neck pain is what people always complain about. So pathophysiology, that's step by step to how it comes in. So there's degeneration of the disc, loss of hydration, the disc height is reducing. There could also be herniation. Then also osteophyte formation. So the bone is actually trying to respond back, grow back. So it causes some growth of some bones that are not needed, leading to narrowing of the foramen and compressing the nerves. So facet joint arthritis leads to stiffness and pain. So spinal cord compression it can result into cervical spondylotic myelopathy, which is now the most serious complication there. So clinical features is you have neck pain and stiffness. There's reduced range of motion. It can lead to headache radiating from the neck. The neurological symptoms is basically radiculopathies like arm pain, numbness, tingling, and weakness. That's like, you know, different nerves come out from that place. So talking about the cervix, you have nerves that are actually coming out to supply the arms. So if those nerves are compressed, you have a referred pain to the arm. Then myelopathy like gait disturbance, hand clumsiness, and also bladder dysfunction. So you diagnose it from clinical examination, that's physical examination, where you are trying to make the person use the part of the body that you are suspecting that are affected. They can do X-rays, MRI, and CT. Treatment include analgesics and NSAIDs, physical therapies, lifestyle modification, then interventional options like epidural steroid injections, surgical treatments, okay, and all of that, okay. Mostly surgical treatment is coming in after you have used other methods, but they have failed to reverse the pain.